Hi, I'm Dr. Dominic King. I'm a sports medicine and interventional orthopedic physician at the Cleveland Clinic. We're going to talk about the post-procedure rehabilitation protocols after the minimally invasive tenotomy procedure for patellar and quadriceps tendinopathy. I'll say with this patient population, this is the absolute most important part of the procedure. The minimally invasive tenotomy procedure as it is a technical procedure. There are certainly different steps you can take to making it a successful procedure, but giving a patient a successful outcome is almost all directly tied to the post-procedure rehabilitation they're going to go through. Again, patients who have tendinopathy of the knee, whether it's the patellar tendon or quadriceps tendon, that tendon is naturally under a large amount of load, but because of the range of motion of the knee, that tendon both of those tendons go through some additional load management that can get them pretty flared up pretty quickly after a procedure like this. So having a good relationship with your rehabilitation and sports therapists can make a much more successful outcome. A couple tips and tricks related to the rehabilitation. The compliance is going to be more crucial than any other area in the body. If patients have hyperemia or longitudinal split tears, you can almost guess that they're going to take maybe about another 4 to 8 weeks longer to recover. And this is one of the defined areas where having a musculoskeletal ultrasound in a physical therapy suite may give some additional ability of our physical therapists to understand when we should or should not be loading some of these tendons. If you have a patient who's out about 8 weeks or 10 weeks and still really having quite a bit of stiffness or soreness, great opportunity to toss an ultrasound on the tendon, look for areas of hyperemia, and see if they might need to change a little bit in the eccentric loading to more isometrics, do some pain modulation, really try to attack that tendon in a different way from a rehab strategy. And out of any other tendons in the body, these are probably ones that can get flared up a little bit easier if they're overloaded too quickly. So understanding how quickly to load those is going to be important. Quadriceps inhibition and atrophy is pretty much ubiquitous in all of these patients, especially any of them that have had this type of pain for a long time. There's a lot of patients who will look like they have very well-developed quadriceps muscles, and overwhelmingly they do, but the inner core of those muscles can still exhibit a large amount of atrophy because of the natural inhibition of the quadriceps. Your body just doesn't want to pull on tendons that hurt, and patients, even being highly functional and athletic with these types of problems, there's going to be some need to retrain that quadriceps. And not only the quadriceps, but you need to address the reason why they develop that tendinopathy in the first place, which most likely is going to be some poor gluteal and core control. So during the rehabilitation protocol, there has to be a concentrated effort, not just on range of motion and getting back to gait normalization. Most patients with patellar and quadriceps tendinopathy got this way because they're active individuals. And in order to get them back to that previous level of functioning and past where they previously were functioning, you're going to have to focus on the glutes and the core just as much as the quadriceps tendon. We have 3 stages of rehabilitation that we break this up into. First is the protective phase. And this is the first 2 weeks. The first week, we try to manage patients on crutches, non-weight bearing. Patients are just more comfortable in this way. We try to keep them off of a knee scooter just because of the knee flexion and the weight into the knee. So this is true crutch use for the first week. Second week, as long as they are pain-free with placing some partial weight bearing, they can start to walk around. And by the end of the second week, they should be walking under their own power without much difficulty. Within those first 2 weeks, we're okay starting some heel slides to about 30 degrees of knee flexion in that first week, and then getting to end range of motion as comfort allows by week 2. Quad sets can start at 0 degrees as early as the first day. Just again, some early loading, giving the knee something to do, and reinforcing to the patient that they're going to make a recovery, right? So they can already start to use this. Again, we're focusing at this point that we removed degenerative tissue. We didn't do anything to the healthy tissue other than increase its percentage within the tendon. So there's a higher percentage of healthy tissue than degenerative tissue after the procedure. So they can start hamstring sets and they can start heel digs. at 0, 20, and 30 degrees, but we're really not loading these tendons. We're making sure to start to initiate the range of motion in some of the isometric exercises. Once we get to the restorative phase, around 14 to 28 days, that's where we can start isometrics at different angles of knee flexion. You're definitely with a formal physical therapist at this point, working 1 or 2 days a week. Addition of gluteal control as early as these first 2 to 4 weeks is going to be important, because that's what's really going to help control the entire low extremity as you're going through stair navigation, which reciprocal stair navigation can be started this early. Remember, these are tendons that we want to reload. We just want to make sure that we're not overloading. In order to determine whether or not we are overloading, we make sure to keep patients around 3 to 4 out of 10 on a VAS score. So we tell patients that rehabilitation and sports therapy is not a painless procedure, but it shouldn't be painful. So if you can keep a patient right around 3 to 4 and they feel like they activated a tendon, but they're not painful, that's really where you want to have them be before you're going to progress them on. The final phase is the reload phase. This is from 28 days all the way up to 60 days and beyond. Specific tests that are nice to consider at this point from a physical therapy standpoint is load tolerance testing. So the decline squat test, quad strength test with the knee at about 60 degrees of flexion can give you an idea of how much a patient can tolerate. You want them to demonstrate a proper hip hinge and range of motion within the hip, especially with a deep squat. You can tell patients that they should be able to expect to return to work with repetitive usage, especially with significant lower extremity use, by about 6 weeks. Most patients are able to return just a little bit earlier than that, as long as they can have some modified load requirements. If it's a desk job or something like that, they can probably return within the first 2 weeks. But expected initiation of sports, and remember, these are normally fairly active individuals who develop this kind of tendinopathy. We tell them about 8 weeks, but again, it's important to note and to be able to throw an ultrasound on there if they're painful, somewhere around 6 to 8 weeks, just to make sure that they haven't developed some tendonitis in the patellar tendon and you don't see hyperemia. If you do, pretty easy to treat if you need to use some ice, some different pine modulation therapies, therapeutic ultrasound, and then consideration of oral anti-inflammatories if needed. And they should expect some type of progressive results to start right around 3 to 4 months. We'll say for really chronic patellar tendinopathy with significant hyperemia and any partial tearing, we've seen this take up to about 6 months. As long as you manage expectations at the start, most of these patients, again, are incredibly appreciative of being able to get back to their activities, and they know how long it's taken them to develop this. So most patients are pretty aware that this is a chronic condition. It's going to take time to get better, but certainly patellar tendon and quadriceps tendon patients should be educated that this is going to be a procedure. This is going to take some time to recover, but if we stick with proper rehabilitation and sports therapy guidelines, we should be able to make a full recovery.